This recording will go over genital warts, which are caused by HPV. Genital warts are very common. It's a viral disease that is sexually transmitted and often coexists with other infections. There are many different strains of HPV. HPV infections have been established as a primary risk factor for the development of cervical cancer. HPV can also cause cancer of the penis and oropharynx, including the throat, tongue, and tonsils. The diagnosis of genital warts is made by examination of the lesions. They're initially small, papillary growths that are white or resemble the color of the patient's skin. They may grow into large, cauliflower-like masses. Multiple warts usually occur in the same area. Bleeding can occur if the wart is disturbed. Warts may disappear or resolve on their own without treatment. They may occur once or reoccur at the original site. Warts can occur on the external or internal surfaces of genitalia, including the mucosal surfaces of the vagina and urethra. Screening for HPV or dysplasias of the cervix is done by obtaining cervical specimens for Pap and HPV DNA testing. STIs frequently coexist with genital warts. Blood tests, HIV tests, and cultures for chlamydia and gonorrhea infections are done at the same time of genital wart diagnosis. If a wart-like lesion bleeds easily, appears infected, is atypical, or persists, a biopsy of the lesion is performed to rule out other pathological problems such as cancer. The outcome of treatment is to remove the warts. No current therapy eliminates HPV infection, and recurrences after treatment are likely. It is not known whether the removal of visible warts decrease the risk for disease transmission. Patients may be prescribed cryodestructive therapies or immune-mediated therapies. Teach the patient that over-the-counter wart treatments should not be used on genital tissue. Surgical management may also be considered to remove the wart. The priority nursing intervention is patient and sexual partner education about the mode of transmission, incubation period, treatment, and complications, especially the association with various types of cancer. Teach the patients who have had cryodestructive therapies that they may experience pain, bleeding, or discharge from the site or sloughing of parts of warts. Teach them to keep the area clean and dry and be alert for signs and symptoms of further infection or side effects of treatment. Inform the patients that recurrence is likely, especially in the first 3 months, and that repeated treatments may be needed. Urge patients to have complete STI testing, since exposure to one STI increases the risk of contracting another. Sexual partners should also be evaluated and offered treatment if warts are present. Teach patients to avoid intimate sexual contact until external lesions are healed, and to use condoms to help reduce transmission even after the warts have been treated. Teach patients to follow recommendations for Pap and HPV testing. Vaccination to protect patients against HPV is one of the most important interventions available, especially for men who have sex with men and immunocompromised young adults. In regards to the HPV vaccinations, you'll want to recognize that Gardasil is a name of a vaccination used for HPV to prevent HPV. So Gardasil or Gardasil 9, you're not required to know the types, the HPV types that each immunization will protect against. Or you can review the ages. It's 9 to 26 years of age. The Gardasil 9 can be administered later up to age 45. So again, Gardasil is an immunization for HPV. Given to people ages 9 to 26. Gardasil 9 can be given ages 9 to 26, but can be administered up to age 45.